All right, well, welcome to this month's CME. We're going to talk about intervention, medication, and administration cross-check in this PowerPoint. So, commonly referred to as the I-Macc. I like to commonly refer to it as one of my partners on scene, Mr. I-Macc, who I always want to run things by before we do anything. So let's talk about what it is. We're going to talk about why do we do it, when do we do it, and who is responsible for it. Okay, so let's talk about how to perform the I-Macc. The first thing we want to start thinking about is how many components of the I-Macc that we need to deal with. So the I-Macc is going to be used for any type of medication administration or procedural event that we're going to do for a patient. Lots of times you hear the terms high-risk procedures. Well, we want to make sure that we're doing the right thing for the right patient all the time. So really you should be doing an I-Macc and confirming what we're doing for every intervention that we do for a patient. Remember, the I-Macc is kind of like a flight team. It's 3 to go, 1 to say no. So the whole thing that we want to do when it comes to the I-Macc is get complete involvement of everybody on scene. So the first thing we want to do is we want to kind of make an acknowledgement that everything needs to stop. So hey, we're going to stop. I need an acknowledgement required to proceed, and then the response from everybody should be ready. So now I'm going to either administer a medication or I'm going to perform a procedure. The response you should get is a confirmation, or if they are uncomfortable with what is about to happen, a contraindication of why that should not happen. That was step 2. Step 3 is we're going to confirm. Confirm the amount or confirm the appropriateness of what we're about to do. The response will be a response of appropriateness. Step 4 is the medication or the intervention that we're going to do, and then that the response should be to go. So remember, when we're doing the cross-check, the clinicians need to remember the RCA rule, which is a ready, confirmation, and contraindication, and amount and appropriateness. All right, so let's talk about some of the statistics of what happens when I-Maccs are not performed or procedures are not kind of collaborated amongst other healthcare professionals. So how many deaths are related to procedural and medication errors in the United States, you may ask? Well, these numbers are quite staggering. Greater than 250,000 deaths of hospitalized patients per year due to procedural or medication errors. That is a staggering number. It's third highest cause of death behind heart disease and cancer. 9.5% of all reported deaths in the country are from some type of procedural or medication error. Those numbers are amazing, and they need to go down. All right, so how does Pinellas County EMS measure up to the rest of the country? Well, in 2020, we had 47 reported errors. 16 were medication errors, and 31 were procedural errors. So I don't know about you, but I think we can do a lot better with this. And by performing the I-Macc, we should be able to get these numbers down. All right, so let's just say we do have an error or a procedural error has occurred. If the medication error occurs, we need to follow protocol CS10, which is our online med control. And medication error is an automatic, immediate online med control contact. The reason we need to contact med control right away is they may have information or have ideas of what we can do to either mitigate or kind of alleviate some of the issues that may have happened from a medication error. Secondly, do not lie. If you make a medication error, own your medication error. You may get remedial training, but by lying, you're guaranteed to have a lot more problems than just some remedial training.